Welcome, everyone. This is Siddharth Damber from Chicago Arthritis and Regenerative Medicine. My guest today is a interventional spine and sports physician with a focus on orthobiologic treatments for musculoskeletal conditions. Welcome, Dr. Shonak Patel.
Thank you very much, Dr. Dambar, for having me. This is fantastic. Honestly, you've been doing some great things with these podcast episodes. So I'm happy and excited to finally be a guest on your show, my friend.
Well, listen, there were so many interesting things to talk with a younger physician as yourself who has all the requisite skills to succeed in regenerative medicine with all the imaging guidance skills, the experience that you've had for the last several years in practice as well, teaching experience. You're a really awesome person to kind of learn from because you have a lot of experience and youth behind that. But before we even get to any of that,
well, before you even continue speaking, you're only a few years older than I am. So let's go.
it's those few years make all the difference, sir.
Fair enough. Fair enough.
But there's obviously a big freaking cloud over like anything to talk about. And I made sort of a point in the description of this that I'm not going to talk about the coronavirus. And part of it is it's just so overwhelmingly negative, right? And like we need to talk about something else. But the other part of it is there's like 8 billion people and 4 billion of them right now think that they are coronavirus experts, right? And they all have the same 10 facts and they're just parroting the same facts. And the reality is, as physicians who are experts in musculoskeletal health, I'm not an infectious disease specialist, right? I am an expert in terms of how this condition affects my patients and how it affects their lives. So I think it's better if we kind of transition into those kind of things. So with
I think
that
that's
said,
a good point. Just one comment on that, though, is that it's not necessarily that people are parroting those 10 facts. The truth is that they're playing telephone with those 10 facts, and that those 10 facts are becoming 20 semi-facts, are becoming 40. God knows what's actually being said at this juncture, and that's how we got this fake news stuff going on. But you're right, and I would love to avoid talking about coronavirus, but ultimately we're going to end up talking about it. For now, let's try to stay away.
right. How are things in Los Angeles currently?
Crazy. Absolutely nuts.
Yeah.
And the reality of the situation is it's not horrible. I have some friends and colleagues that are in one way, shape, or form at or near the front line in LA. And things are not great, but people are starting to stay away from the emergency room unless they have to. People are starting to stay at home a little bit more. And I think that that's what's, ultimately really important. But it's not great over here.
Right. Yeah. I mean, we're just starting to hit, the escalation of this. And I think the difference is last week, I think there was so much sense of lack of control in terms of what was going on. I think there was more a sense of panic at that moment. And right now it feels like, okay, we have some sensible decisions that are being made in some cities and states. And maybe there's a little bit of a plan that maybe works. And so it feels a little bit better right now, but we'll see what happens over the next couple of weeks. In Chicago, people have been generally pretty good in terms of abiding by the shelter down kind of rules. And the mayor that we have here she's pretty smart, tough. And, when she noticed that people were starting to aggregate over the lake and parks, she really shut that down as well. So I feel like where we were last week compared to where we are right now, it seems like we're making some decisions that maybe help, but hopefully we've kind of caught this in time.
Yeah, that's the hope at least. Then again, my pediatrician posted a picture last weekend of people having a party in the park and straight up barbecuing, picnic, the whole nine. And this was 2 days after Los Angeles and California as a whole instated a stay-at-home mandate. So, but things are seemingly, people are seemingly listening a little bit more now.
Right. Good. Now that we've got that out of the way. What are you up to these days, right? I mean, as a physician, where we're doing all elective things, where we're all sort of suddenly shut down by 80, 90%. I see videos of you on IG doing push-ups with your kids. And so obviously you're spending time with the kids. But what else are you, how else are you trying to deal with this as a professional in terms of connecting with patients, value to patients? Like what are you doing these days?
Well, actually, let me update you with what I've been doing for the last month. Because in order to say what I'm doing now, I kind of have to, um, lay the groundwork here with what's been going on. We've actually had some fantastic changes on my end. Last month, after we saw each other at IOF, for everybody that's listening, the Interventional Orthopedics Foundation, now called the Interventional Orthobiologics Foundation meeting in the middle of February. Um, After that, we had some fantastic changes. We actually uh, relocated now to Arcadia, California, outside of our Beverly Hills office. It is an office that is within the office of my fellowship brother, Dr. Max Moradian. He's an interventional pain physician. He does a little bit of regenerative medicine as well. But he has a larger facility with some state-of-the-art equipment. And it was actually really fantastic change for us. Then actually ends up being a lot more convenient for a lot of our patients as well. So we're excited to really have that change, still offering the same Regenexx procedures and still high level of quality care. Still my awesome staff is with me, but we're now in a different location. So that was as of March 2nd. And we hit the ground running. Things were going really, really well. And then, of course, everything with COVID-19 really started making us pump the brakes a little bit. We started switching over to telehealth pretty early on and really stopped seeing any patients that were at higher risk, older patients, et cetera. And then we started canceling or more of our elective procedures overall. I was actually involved with writing a manuscript, a recommendations, guidelines for musculoskeletal physicians and pain doctors in how we should really be proceeding during this time with COVID-19. And as outlined in that, I was still doing some select low-risk procedures in a very safe manner. That being said, we stopped all of that as of this week as well.
Yeah. How do you define low risk versus high risk when it comes to percutaneous procedures?
So really when it comes to low risk, the first and foremost starts with the patient. As we know with COVID-19, the older you are, there are more risks that are associated with it, although we have seen younger patients develop significant issues. The truth is that I was considering higher risk, really anybody over the age of 65, certainly anybody over the age of 70 or 80. Anyone with any other medical comorbidities, any autoimmune conditions or anything along those lines, all falls into that high risk category. But as far as procedures are concerned, really low risk to me is anything that's blood platelet based or even more minor than that. Now, the interesting thing is, and something that we identified in our manuscript as well, was that there are traditional interventional procedures that we may put into the high risk category. Things like cortisone injections, because cortisone is known to actually decrease our immune system. So we have to be a little bit selective in terms of when and who we would do those type of procedures for.
Smart. One interesting thing that you brought up was this the manuscript or recommendation that you guys came out with. What's really interesting about that for folks who don't know about this is, we've had like a significant lack of leadership, I think, in this country in general with this, with what we're dealing with right now, not just on the political level, but even in medicine, on that very kind of high level specialty societies. We were hearing nothing for those first couple of weeks. On social media, I saw a lot of doctors on a grassroots level who were leading, either in action or words, and trying to support each other and support patients and try to give good guidance. But we really weren't seeing anything until the last few days from our specialty societies. And so you guys came out with this recommendation for interventional spine and pain treatment in this setting, I think last Friday or Saturday. And
Mhm.
there was really no other guidance out there until then. So kudos for you for doing that. And how did that even come together? Because that seemed more like a bottom up kind of thing rather than a top down thing.
Yeah, so actually, it was my new associate, Dr. Moradian, who came to me, and he does a lot of epidural steroid injections and things along those lines. And he came to me and he was like, "Hey, what are your thoughts about this? Should we be doing these injections?" And I mean, generally speaking, my recommendation is no. But in light of the fact that this has, cortisone has an immunosuppressant effect, I was like, look, at the very least, for older patients, we should be considering A, stopping these procedures entirely or even reducing the dosages significantly. Because what little research we have says that, you know what, these procedures do have side effects. And a lower dose might not necessarily be less effective than a higher dose. So that's how we kind of started that conversation. And Dr. Moradian had a few colleagues of both of ours that we kind of brought together as the core. And then I reached out to some of my mentors and some other giants in the field, such as Dr. Jerry Malanga, who was my mentor from back in my residency, Dr. Gary Chimes, Dr. Rahul Desai, Dr. Pratap Jayaram. And we basically, brought together some people that were at various different academic and private practice settings to try to put this into writing. And we actually tried to reach out to some organizations. Um, the Spine Intervention Society put together their own piece that came out just a couple days before ours. And then since then, there's been a few other organizations that have put down some similar guidelines overall.
That's outstanding. I mean, when we think of how we can offer value, right? I think a lot of times for physicians, a lot of our work is very hands-on. It's very direct, right in front of you, the patient. And there are other ways to add value, right? And I think what you guys did that week ago was adding value immediately to your colleagues,
Thank
other
you.
physicians, and certainly to patients as well, to show that there is leadership for what we're dealing with. And I think sometimes for physicians, you have to realize that you may not have answers, you may not have a solution, but do you have reassurance? Do you have guidelines? Can you lead people through a difficult time? And so I think that's a really great example of that for such a young physician to
Thank
be
you.
taking that leadership.
Thank you. It means
That's
a
very
lot
impressive.
coming from someone as old and wise as you are.
Thank you. Thank you very much. Yeah, it's interesting because I think we've all kind of realized that we're slowly moving into a world where work is going to become progressively more remote. And I think physicians, we've had this sense that there's a slow change, even what we'll be doing in the future. And this definitely accelerates that. I think telemedicine is obviously a technology that lets us do that in terms of connecting with people in different ways, not only the people that are like 5 miles away from you, but anywhere in the world. I think an interesting aspect of communicating on social media right now is getting questions from people everywhere in the world about, hey, what do I do about this? And it's interesting because we're always cautious in terms of how we describe and recommend in those kind of scenarios, but we can still lead in small ways like that. You've been very active on Instagram and other social media for a few years now. How do you see in an age where at least temporarily for the next few months, we're all going to be in this kind of weird limbo right now. How do you see leading going forward as an individual physician, with colleagues, with patients? As someone who's already embraced some of these technologies, how do you see sort of embracing that longer term as well?
I think those are fantastic questions. I mean, the reality is that telehealth is going to be, to a certain extent, the new norm. Um, and even when we're beyond COVID-19, I think that that is going to continue to go on. I think being a regenerative medicine physician, and especially being a part of the Regenix network, I think it's fair to say that you and I both have been doing telehealth in one way, shape, or form, because we have patients that come in from out of the city, out of the state, out of the country, to come see us for their various conditions. The truth is that I have found myself doing telehealth for patients that are 5 miles away, because LA traffic is what LA traffic is. But the reality is that I think that this is a really important way of communicating with patients, and communication is going to be the name of the game. And that's going to be via telehealth, with platforms that are available to physicians and patients. But it's also going to be through social media. I think it's pretty much on a daily basis that I'll get a message from either a patient that I've previously had, or somebody that just has questions about their condition. And even though social media is not the appropriate way to, divulge medical recommendations, it is a way to communicate. And it is a way to say that, hey, listen, you know, I hear you. There are folks that are here that are able to hear you and hear that you are in pain, that you are having issues, and that we are here for you. And we might not be able to give you advice right now because we haven't seen your imaging, we haven't seen or examined you or whatnot, but we are a resource for you. Let's set something up. Let's look at your imaging together. Let's go over your anatomy, and let's go over all of the options that are really available for you, even beyond doing procedures, because there are plenty.
Yeah, what's really interesting is I think everyone, like, as a species, I think we've in the last month suddenly had an elevation in our sense of risk. Like we suddenly
Yeah,
realize, wow, there's more risk than we realized.
yeah,
And it's interesting when this first started breaking out in the United States, a lot of physicians, when you heard about what was going on in China, said, okay, this looks like a nasty virus. I think we'll get through it. But I think a lot of us had a very measured take to it, which is definitely appropriate from a physician standpoint. And I think a lot of us were relatively surprised in terms of what we started seeing publicly. But I think it's a good thing for the general public long term to start thinking about risk in a more proactive way, where they're really thinking consciously about, look, does it make sense for me to do treatment X? What are my risks? What are my other options? From the regenerative medicine, non-surgical MSK side, a lot of our job is to guide people in terms of, what are their other options? What are their other benefits or risks that they need to be thinking about? And so I don't know how long that consciousness sort of stays elevated. And I don't know, it certainly is not healthy to be astronomically anxious and panicky, but I think there is something possibly good that if we can have conversations with people where talking about risk in a nuanced and sensible way is actually appreciated more readily. Because I agree with you that it's not all about, hey, what can we do for you right now? A lot of it is how can we get you better educated on the process so that you are living a better, more healthy lifestyle. And part of that is understanding risk,
yeah.
which I think this definitely forces us to do.
Well, I think the key point in what you're saying right now is the fact that, and I'm generalizing, not everyone's like this, but the U.S. doesn't react unless there's a panic involved. And I have a love-hate relationship with the word panic. The reality is, panic to me is that I have no idea what's going on, and I'm running around like a chicken with my head cut off, and that's it. There's nothing that I can do, right? And the reality is that there is a lot that we can do, even when we are kind of isolated in this little box here, right? The reality is that there's a lot that we can do for ourselves, for others, And the reality is we are not really quarantined to being stuck, you know? Um, but the love that I have for the word panic is because without the word panic, people would still be gathering at the park and having a picnic, right? If it wasn't for that word, people would be freaking out, right?
Yeah. There's always knuckleheads in every crowd, unfortunately. and if global pandemic is not enough to get you to listen to authorities, to stay inside, spend more time with the family, watch a little bit more Netflix,
Right.
maybe a little bit more strongly worded recommendation is needed, or maybe an occasional fine is needed, unfortunately. The strange thing is that, like, the concept of herd immunity requires the knuckleheads to kind of come along as well.
Mm-hmm.
and
Yeah.
the strength of this country is that we allow knuckleheads to survive and thrive because they add value in their own kind of way, whether it's new ideas or new concepts. That's a great thing about this country. The flip side is when you look at what can happen in a place like China, when they say, this is what we're doing, that's what they're doing. Like
Yeah.
there's very little question about it. It's just sort of adopted immediately if it comes from the right authorities.
And there's pros and cons to both, no doubt.
Right. It's interesting. I think realistically, the world, like the world is changing, right? And this accelerates that. And it's not as though, you know, the world is suddenly going to turn the opposite way, right? But as humanity, like, our access of the world has changed. It's slightly changed.
Yeah.
Long term. And it may not be something that in 6 months we're like, wow, it's a totally different world. We may sort of get back to life or business as usual. But I think there's enough of a societal worldwide change where over the next few years, we're going to see dramatic changes, whether that's in virtual reality, augmented reality. The example I give to people is we were visiting my sister-in-law in Los Angeles over winter break. And she took us to she took us to a virtual reality arcade.
Yeah.
And I'd never experienced that before. And as a middle-aged man, when you put on the goggles, the headphones, and you're in it, like, you are fully in it. And I can imagine that the incentive to sort of push that further, to augment that even further, is like, we are destined to have more of those tools at our clinical disposal for sure, I think, in the next couple of years, which I think makes things interesting because traditionally medicine has been so local centric. And I'm just completely convinced that if I need to find the pediatrician who I think has the best interest in my daughter, and I can find that person anywhere in the world, and their philosophy, their service, their, you know, client service fits what I want, I'll try to work with that person.
Yeah.
And I think we're slowly shifting into that world where we're going to be judging our physicians in a similar way that we do other kinds of services, that I think we need to elevate the expectation.
I think that's fair. And honestly, that's going to be more and more in our specialty as well, because people are starting to realize that as there has been an explosion of people that do regenerative medicine treatments, whether it's stem cells or whatever you want to call it, there are those that are looking at patients holistically with this as a tool in their tool belt, and are using this tool appropriately. And then there are scam clinics that are doing things inappropriately, right?
Absolutely.
And as people are becoming more and more aware of the ability to have telehealth as an option, right? Being able to talk to Dr. Thambar in Chicago when you're a patient in, you know, South Africa, that really makes a big difference. And I think that's going to be really impactful as time proceeds.
So, you know, it's interesting. Before this past month, right? I mean, the big sort of buzz for the last couple of years, realistically, in our field was, how are we getting the folks who take this field seriously? They're professional about it. They're reasonable about it. They're slowly, progressively, incrementally pushing the field in the way that physicians typically do. There's an aspect of the field that I would say is outside of that, that is really kind of misleading patients, not really going the right direction, and kind of dragging us down. You have really spent a lot of time the last several years from the teaching end with the Interventional Orthopedics Foundation, Interventional Orthobiologics Foundation. What have you seen over those years? Like is there a change in terms of who you see is getting interested, how they're coming in? Like what have you seen that's kind of changing in that regard?
I think that's a loaded question. That's there are several different types of physicians that are starting to do these procedures. There are those that have been doing the traditional interventional spine or interventional pain or sports medicine and corticosteroid injections. By the way, if you hear crying in the background, that's my daughter who just woke up from her nap.
Understandable.
And we'll see. My home office is also the living room, so let's see how this goes. But those are the docs that have been doing corticosteroid injections and are realizing, you know what, this isn't the best treatment for patients, right? There are a lot of side effects associated with these traditional insurance-covered treatments, and they want to get more exposure and learn more about these orthobiologic solutions, which are, at the very least, safer than the traditional, and if not much more efficacious. So that's category one. Category two is the surgeons that fall in that same kind of boat, that are like, you know what, surgery really should only be used as either A, an emergency, or B, a last resort, and I have these other tools that might be an option for me. Then you have your category of people that are attracted to this because it's potentially a cash maker, that are looking for a way to make a buck. Now, I think that that's a lesser category. I don't think that that is the majority of people that are out there. And quite frankly, I think there's probably good and bad in all three of those categories. Even the people that get into it for cash initially, they might have the realization that, you know what, these are actually legitimate treatments that could be beneficial for patients. But I think that third category is really where we get into some shady characters. And it's kind of crazy how many shady folks that I've now run into at these various conferences and courses that I've been teaching at, or even just attending. There's really some interesting people, and it's hard for me as a physician to kind of parse out who's legitimate or not. I can't imagine the difficulty that patients face.
Yeah, it's interesting. I think what these last couple of years have proven to me more than anything else is there's so much noise and information in the world, but there's very little like legitimate, reliable information, right? And I think it's really contingent on physicians who are trying to be the utmost professional, ethical, do things the right way, and have the best interests of their patients, their colleagues, the field. Like it's contingent on us to speak up more because as you said, like if it's hard for physicians to figure out who's legit or not, with some exceptions, then it's probably impossible for the general public.
Yeah.
And we're in this weird space in the field right now where there is a slow professionalization to the process where the folks who believe in doing it correctly are aggregating together progressively.
Yeah.
But we're not quite at the stage where there's like a strong enough nucleus where you can sit there and say everything outside of this circle is bad and everything in is legit,
Right.
which you have in a lot of other fields. But that process is happening,
Yeah.
which I think is exciting and interesting because you see the same people at all these meetings, right? You see the same people who are interested in talking about this in a proper way. And it's the usual suspects, which tells you these are the people who are obviously legit and doing it correctly. But it's an interesting time in the field that we're still trying to self-regulate. And it's hard for me to disconnect sort of what that world was and to what we're moving into now, right?
Yeah.
And
Well,
I
it's not
just think,
linear.
right.
It's not like we're going from here to here. It's one of those like we're going all over the place, and quite frankly, there's going to be different factions that go all over the place until we get to the future. So it's not an easy target to follow.
It's interesting because if for physicians who are on LinkedIn who sort of follow some of the chatter, there are moments where you'll see physicians arguing pretty aggressively with each other, and when you realize like how much similarity that they actually have on their topics, and it's like, okay, you're parsing some details about this product, that product, and that's actually what you want. You want that kind of push and pull
Yeah.
of people who are in the fray, because that's how you really figure things out. But the folks who aren't even in the fray, right, who are just completely outside of the arena, those are the ones that we have to be concerned about. But I think the nonlinear part of it, the up and down, is interesting and kind of exciting. And it's how medicine has typically kind of grown and learned, based on that kind of push and pull.
Yeah, and I think that's an important point that you make in terms of um, you mentioned before, like, you know, the circle of people that we would trust and then those outside of that circle. You know, as of now, it might be as simple as who is having those more in-depth conversations and arguments versus who's not. You know, or who's at least paying attention to those arguments versus who's not.
Right.
Because there are plenty of folks that are not, you know, engaging in those conversations, but are still paying close attention to them and doing the research and making opinions and you know, following the data. Those physicians are the good ones. Now, how do we parse them out as the public, as the lay people? That's a little bit more difficult.
Right. Right. I think we're getting close to that, though. I think we're
Yeah.
getting close to the
Yeah.
point where we may have some sort of central bodies that sort of say, look, you need to have this kind of, proper kind of progressive training. You need
Yeah.
to have this kind of proper focus. This is the right way, the wrong way to do it. I don't know if malpractice insurance is quite at that level, that
Mm,
sophistication yet, but
yeah.
I think at some point that is sort of where the rubber meets the road.
Yeah.
But we're definitely progressively getting to that.
Well, I think there's the things that I tell my patients to look out for, because when I see a patient and they're like, you know what, I'm looking around, I'm talking to other docs, I'm like, great, talk to other people, because I think it's good to get additional opinions about things, right? Um, but you got to use your nose. You got to have a sniff test. And a few things to watch out for is really asking how long people have been doing things for, ask if they collect their data, ask what training that they've had. Um, and take a look at their website, because if on their website they are a plastic surgeon treating, you know, urinary incontinence and anti-aging and orthopedic injuries and diabetes and autism and whatever, then maybe they're not the specialist that they claim to be, right?
Right.
So, you know, that sniff test ends up being so important moving forward.
Yeah, it's so true. I mean, medicine is not that dissimilar to, let's say, athletics in some ways, right? Like
Yeah.
Michael Jordan may have been arguably the greatest basketball player ever. He wasn't so great at baseball, right?
Right.
Like it's
Right.
hard to be really great at a lot of things. And
Yeah.
so I think medicine certainly falls into that same field as well. Stick to sort of that narrow channel where you really do have some expertise and specialization. I think
Absolutely.
that'll keep most patients at least in the right realm. Shonik,
Absolutely.
I know you spent some good amount of time here, and I appreciate that. I can hear kids waking up, and I'm guessing that's probably a signal to us to start to wrap it up. Before we do,
Unfortunately.
tell me, again, we've got this whole Corona business right now, but tell me sort of what are things you're excited about in the field, in your own career? Like, what is exciting with you that's coming up, or that you
Honest,
see is coming up?
Honestly, I am excited about more telehealth. I think that it is a wonderful way to be able to reach people that are otherwise unable to be reached. And I think it's a great way of getting really face to face with somebody that's otherwise, you know, more challenging. People from out of town, out of state, and especially at this time of social distancing, right? But I think that this is there's going to be more and more technology that improves the value of telehealth, and I think that that's going to be something that's really exciting overall. And quite frankly, I'm just looking forward to the way that our field is progressing and being able to provide such higher level of care to patients and keep people away from unnecessary procedures, unnecessary surgeries, and unnecessary harm.
Well said. Lastly, Shonik, thank you for your time. I know that we can find you on Instagram, Stem Cell Dr. Patel.
Mhm.
How else can patients or people who are interested in connecting with you, how can they find you?
So Instagram, Facebook, Twitter, and now TikTok. I have added on to your TikTok presence on there, but all of those at Stem Cell Dr. Patel. And I'm currently available on our HealthLink Medical Center website. That's www.healthlinkcenter.com. And I'm going to be making a new website soon. If you are interested, you can always see me on the Regenexx website also. And that'll have all my up-to-date information on it.
Great. Thank you very much.
Thanks so much for having me, and I'll see you soon.
Yep. Bye-bye.